Good evening, Yorktown. This is Supervisor Matt Slater coming to you from the Town Board room here at Town Hall. It's Friday, January 15th, and we're here with another COVID-19 update and how it's impacting our community. As always, happy to share my screen if Zoom would let me. Happy to share my screen and show you the numbers that we have in our community, but Zoom is not allowing that to happen. So I'll just tell you. Again, we've had 32 new cases here in the town of Yorktown. That was yesterday's numbers provided by the Department of Health. Again, that means 32 people tested positive for COVID-19. Currently, according to, again, the Department of Health, we have 536 active cases, meaning 536 people who, within a 2-week period, tested positive for COVID-19. We've continued to receive a number of calls in the office, and I think it's working. Yes, it is. Great. And so I'm going to show my screen real quick here so that we can walk everyone through this. And again, there you go. So again, I'm going to take everyone back so you all know how to access this. This is our, again, new website, fairly new website, the yorktownny.org website. Come straight on down to the spotlight, and it's always right there. Yorktown's coronavirus updates, and it gives you the numbers right on the screen. But if you click on it, thanks to our staff, specifically Robin Steinberg, you can see a breakdown by zip code, and you can see more specifically where in your neighborhood or by your zip code what the current situation is. So again, today we have, I said 32, it's 29, and 522 cases. Those are the updated numbers even more recently than what I was given previously, so that's great news. So 522 cases, which is down from what we had just yesterday at 536, and 29 new cases for the town of Yorktown. Again, as you are looking at this map, you can click on the zip code and it breaks it down. So in the Mohegan Lake area, 10547, 6 new cases since yesterday, 91 active in that area, 565 cumulative. Here over in the Cortland Manor section of town, that western side of town, the 10567 zip code, 14 active cases. Thankfully, no new since yesterday, and a cumulative caseload of 129. Again, you can click all around town up into Shrub Oak and Jefferson Valley as well. And of course, our friends and neighbors down on the south side of town in the Ossining zip code of 10562. You see there you've got 8 active cases, but no new cases, which is, again, a great sign. And of course, majority of our residents are in the 10598 zip code, where we had 21 new cases and 360 active. So that's where we stand today. I also want to point out, if I may, to the right over here, you'll see a whole host of resources from the other data dashboards, which gets you to the county dashboard. So if we click right here, this gives you the whole county dashboard that they've released. Tells you that the total tested positive, our positivity rate for the county was at 5.2. We had 1,000 new cases in Westchester as of January 14th, and it gives you the breakdown by town and village all across the county. But I want to go back to ours. Again, you have the other dashboard, symptoms and testing on the right-hand side, and the topic of conversation today, and basically the topic of conversation that we've continued to focus on, is vaccine information. And right here on the vaccine information, you can see COVID-19, get the facts. You've got the Am I Eligible website, as well as the county's COVID survey. And you also see the state's vaccination hotline. Now, I use this to segue into our guest today, who we're thrilled to have with us. This is his second time with us, Dr. Lewis Cole, who is the Medical Director and Chief Safety Officer for CareMount, which is one of our local providers. Dr. Cole, how are we doing today?
So far, so good. Would be doing better if I saw 1 million doses of vaccine pop up, but pretty good.
Yeah, that's the question. I know that my office, the town clerk's office, we get calls, multiple calls every hour. Where can I get the vaccine? I can't get an appointment until April at this point. So on and so forth. So, could you give us an update on the current situation regarding the vaccine, specifically for our area?
Sure. So, good afternoon, everybody. Thank you for inviting me. So, the state and the feds have unfortunately done a bit of over-promising and under-delivering to this point. When you read what's going around, sign up, it seems like you can just get the vaccine this weekend. That's not the case. New York State is only getting, I think it's 300,000 or 600,000 doses a week, which is just not enough to vaccinate everybody. The governor has said that they're not going to have enough doses at that rate for serious medical problems are going to get vaccinated, certainly in the next 3 to 4 months, and maybe everybody, hopefully everybody before the summer. But it's going to take some wind up. The state is putting a lot of energy into their centers, the big vaccination centers, like the Westchester County Center, and they're running very nicely, but it's a limited number of patients with a limited number of vaccine. You're going to see vaccine in some of your local pharmacies. Some businesses are supposed to become sites, and eventually medical practices will. Caremount, for example, I was just telling Mr. Slater, we give out 230,000 doses of vaccine every year. It's what we do for a living. So far, we've received no doses, and we don't really know when we will. We've been approved for doses. It's going to be a very restrictive process. Not every doctor's office is going to be able to manage that process. So it'll probably be the bigger groups, but smaller offices may get vaccine given to them by hospitals to give out, which would be great. But it's really restrictive in terms of the type of refrigerators and freezers you can have, ability to enter the data every day into the state, have it tracked, to monitor it, and also the ability to make sure people are safe after they get their vaccine. So it may be next week we get vaccine, it may be the week after. For our practice, we're going to offer some vaccine to the public, and we're going to make sure that our patients get appointments to get vaccine. So that's all to be determined. How I manage it is going to be very different if they give me 300 doses next week versus 6,000. We've asked for more than 4,000 a week. If I get 4,000, many of you on this call, if you're over 65, are going to start getting notices that you can come in and get vaccine. Please sign up. But it's all going to depend on distribution. But I think the main point is there will be enough vaccine. Each one of these companies is planning on millions and millions of doses. And especially when the other two companies come online, they're a little easier to manage also. With the Pfizer vaccine, you've got to keep it frozen at minus 80 degrees. And these other these two vaccines are just, either a regular freezer or a regular refrigerator. And the Johnson & Johnson is a single dose instead of the 2 doses.
Really? Oh,
so
okay.
Things are going to, that's at least what they're saying now. Okay. The last trials, what they call the phase 3 trials, are not done. So everything is just, this is what we hear so far. Sometimes that changes when they release the data.
Right. And the AstraZeneca, is that 1 or 2 doses? Do we know
I'm pretty sure the AstraZeneca is going to be 2 doses.
Okay. And
the AstraZeneca is the one where they actually gave they gave a half a dose for the second one instead of the full dose and got a better response. So the AstraZeneca is really looking like 2 doses.
Okay. Can you, when you said that you're going to be doing outreach, once you receive your supply from the state, you're going to be doing outreach because obviously Caremount's, I'm looking outside the window here and there's a Caremount facility right across the street. So for our residents, obviously you've got a very large footprint within our community. what can they expect on an outreach point of view from Caramount once you know, okay, we have X amount of vaccines that we're going to be getting, and you're going to begin reaching out proactively to our residents? What should they come to expect, if you can explain that to us?
So everything's going to be by appointment. The state wants to hold a certain number of appointments open for the general public, people who aren't necessarily our patients. We're, of course, going to do that. But you'll have to go on the state system to sign up for those. For our patients, and we're going to do it by the people we think are at greatest risk. So it's going to be older folks, people with multiple medical problems. The reality is, if you're 32 and perfectly healthy, you don't need the vaccine as badly as someone who's 75 with 12 medical problems. On the other hand, I really want the 32-year-old to get vaccinated so they stop spreading it to the 75-year-olds. So, but we are going to go first. We're going to look at our patients who are at the highest risk. And as we get vaccine, we will start notifying you that, hey, you can come in, you can book these appointments. For folks who don't have internet access or emails, we'll end up calling them. Particularly if you're in any of our care management programs. I would expect that other medical groups and medical practices will do this. For the pharmacies and the Westchester Convention Center, the Westchester County Center, those are still going to be sign-ups with the state. Some of the hospitals, like Northern Westchester, are going to be holding vaccine clinics as well. And right now, you probably have to sign up with the state, but the big systems like, New York Presbyterian and Northwell will probably in the next week or two have their own signups. So you're going to see a lot of advertising. If you're our patient and someone wants to give you vaccine and you want to get it, I wouldn't tell you not to get it, right? This is a vaccine that if someone offers it to you, take it. We think everybody should be vaccinated. The vaccines are safe. So don't wait on anyone in particular. Right? If you go to a different practice, not Caramount, and you find out your doctor's not going to have it because their office can't manage it, you got to start to look for some of these other resources.
That's great to hear, and we have heard also from Northwell for our community as well, and I know that they're looking at ways to supply vaccine directly to the town of Yorktown. I've gotten questions on a couple of things. Individuals who are immunocompromised but under 65. Do you know if they're A, eligible, and B, could you provide some advice for them if they should be vaccinated?
So they absolutely should be vaccinated. New York State has not opened up vaccination to them yet, but they're going to. The governor had, from what I heard, planned to announce that this week. But the reality is there's not enough vaccine around for everybody, and it just as you add groups, it makes it more complicated. So if you're less than 65 and you have risk factors, this is obviously very frustrating. But the reality is there isn't enough vaccine yet. So if you have risk factors, if you take any medications that compromise your immune system, if you're very overweight, if you have heart conditions, lung conditions, you absolutely want to take the vaccine.
Perfect. That's great. And then what about people who are, because again, I can speak for the town clerk's office because I spoke with our town clerk, Diana Quast, today and yesterday specifically about these questions because she's getting them as well as my office. Allergies. If you have or are prone to allergies to medication, what steps should you take to make sure that you're getting the vaccine in the safest environment?
So there are different types of allergies. There's what we call in medicine, there's immediate allergies, immediate hypersensitivities or allergies, and then delayed. Delayed basically means rash. Immediate means you can't breathe, your blood pressure goes down. That's what we call anaphylaxis. A lot of people have that to bee stings, so they carry EpiPens to jab themselves with. So if you have a history of having immediate reactions, I probably would not choose to take a vaccine outside of a medical facility. Because it looks like right now they're saying what we're being told is that you're really not at risk if you have a bee sting allergy, for example. And I know some of those people have been vaccinated recently and they did fine. But if you couldn't breathe and you ended up in an emergency department because you got an injectable medication or a different vaccine, I would want to be vaccinated in a medical facility. If you are not sure, let's say you get a terrible rash from 12 different antibiotics. We are seeing people who are very prone to rash from drugs who get a rash from this vaccine. It's still just a rash, but it's not a bad idea if you're really concerned about having a lot of allergies to see an allergist. In our practice, some of these folks who have a lot of risk but want to be vaccinated, we're going to be vaccinating them in the allergist's office because the allergists are used to managing severe allergic reactions. So we have the ability to do it in a safe environment.
Right.
So just if you are very allergic, particularly if you are I took this medication and I almost died kind of allergy, I probably would not take the vaccine in a pharmacy because all the pharmacy can really do is call an ambulance for you. Some of them may be able to give you an EpiPen. I don't want to say they can't because I'm not sure, but I would probably elect to do it in a medical environment, whether that's a hospital clinic, a medical practice, someplace where they can take care of you if you have a severe reaction. But most people that we've seen so far, and obviously several million have been vaccinated already, are doing just fine. Right? There's probably a little more likely to have a rash from what we see so far than the flu vaccine, but most people are doing just fine.
That's great. That's really great to hear and very comforting. But so when you're saying making sure you're in a medical facility, should they avoid a place like the county center?
The county center has EMS and paramedics there who can at least start epinephrine. So and there's a lot of attention on not that many people. So the county center says it's ready to handle medical emergencies. So I have not been to the center, but I know they have EMTs who respond first, and then they have paramedics. And if you need to go to the hospital, they can take you, and the paramedics can give you an EpiPen. So it's not a medical desert. There is attention there. Right. So that's probably something in between. It's not quite an allergist's office, but it certainly, there will be people who will attend to you.
Okay, that's great.
The other thing that we should probably cover, these vaccines cause more reaction than something like flu vaccine.
Yes.
They do make a lot of people achy. We're seeing fevers. We're seeing aches. For most people, that's gone by the next day. In the first 2 or 3 days, it's not unusual for people to feel a little bit cruddy. That's not scary. That's telling you that your body is reacting to the vaccine. That's what you want. You want to make an immune response, so if the virus shows up, your immune system stomps it. So that is not a negative. That's just telling you you're having a really brisk reaction to this vaccine. But don't be surprised if you're achy the next day or even that night. Some people are getting low-grade fevers, but they're not sick. You're not coughing. Your nose is not running. These vaccines, none of the vaccines that are going to be approved in the next 6 months and probably not a year, they are not a whole virus. They're not a weakened virus. They're tiny pieces of the virus. They cannot give you COVID. They can't give you the flu. They can't give you a COVID-like illness. A little achiness, a little fever, yes, but not COVID.
And what about the second dose? Does a second dose, should people, when they get their second dose, because again, right now we're working with vaccines that require 2 doses, should they expect similar reactions to the first dose?
Yeah, people are definitely having reactions to the second dose, some a little bit more than to the first dose. There were people who had nothing to the first dose, but after the second dose, they were achy and feverish.
Oh, okay.
But again, so it's achiness, fever, and fatigue. Most people don't have fever, a few have. But we are definitely seeing achiness. We're seeing soreness in the arm where you got vaccinated. We're seeing redness 3, 4, 5 days later. The arm swells a little bit at the site and is getting red. It's not an infection. It's just a local reaction to the vaccine. There's nothing you need to do about it. Nobody's going to the hospital for it. It's not horrible, right? It's so well worth taking this vaccine.
Oh yeah.
It's the only way we're going to get our world back.
Right.
Is to take this vaccine.
Now, one of the other questions I've received is if someone gets the vaccine and they get their double dose, is the expectation that that's a one time, or are they going to have to? Do we know yet whether we're going to have to come back, whether it's next year or a few years down the road, to get vaccinated again?
It's a great question. We don't know yet, unfortunately, because the problem with these viruses is they can mutate.
Right.
So we already see it mutating. We see this strain running around that makes it more likely to spread. Doesn't make it more dangerous, but more likely to spread. Viruses mutate, and they mutate as they go through more and more and more people. In Asia, every year, flu virus goes from people to chickens to pigs to people back to chickens, and that's why it mutates so much, which is why every year we have to get a new flu vaccine, and we have to guess which strains are going around. Some years it has 3 strains, some 4. So a lot depends on people's behavior too. So if folks are, living too close to animals and start sharing it, now hopefully birds and pigs won't pick up this virus, so we won't see that chain with farm animals like we do with flu. But the bottom line is we don't know yet. We hope this is long-lasting, once-in-a-lifetime protection, but it's too soon to tell.
Gotcha. Well, that's good. That's still something for us to keep an eye on, but I appreciate that information. Again, going back to the phone calls that I've received in my office, our seniors are just so concerned. They're nervous. They're frankly scared, I think, as well. And they're trying desperately to get this vaccine. What guidelines can we give our seniors as they wait to receive their vaccination? What should we tell them that they should be doing?
They should be doing what they've basically done now for a year, which I hope they're good at. Stay in your bubble. The only bubbles that most people seem to have seen on New Year's Eve were champagne bubbles with their friends, which is why so many people got COVID. Stay in your bubble. Wear your mask. We've made it this far. We're going to make it a couple more months. Right? Don't invite people into your house without masks. I don't care if you know them. I don't care if it's your nephew or your cousin, and she's such a nice girl. She's going to give you COVID. I guarantee it. I have to say, sorry, I'm not young, so I can make fun of young folks. They are the ones sharing this rapidly, and they're bringing it home to families when they go to college, when they come back, when they go to school. People that you live with should be the only people that that you're not wearing a mask with. And if you're living with kids, and you're living with college kids, and if you're living with your young adult child who goes to the city every day to work and comes back, you still need to wear a mask with them. Just because you love them doesn't make them safe. And that's what we're seeing. But we were so safe. And who's been in your house? Well, just my son. And where was he? Well, he's been away at college and he just came back. They're going to give you COVID. So we're in the home stretch. It's kind of like you're in the trenches in World War I and you just heard that there's going to be peace sign tomorrow, but you stuck your head up and you got shot in the head. You're the last one to go down. Don't do that. Yeah. There's just a little time left. You don't need to do anything that you haven't been doing already. Just be careful. Be a mask wearer. I'm alone in my office. My door is shut. Nobody else is in the facility right now. That's why I don't have a mask.
And that's why I have a mask. That's why I wear a mask here.
And you see Mr. Slater has a mask.
Our staff is here in the room with us when we do these, so I make sure I continue to wear a mask.
So for anybody who tells you that the masks are not protective, they're wrong. They're highly protective. We have kept our medical staff safe. Our urgent care centers have literally been pounded with COVID over the last year. They're all safe. Our staffs have not gotten sick. The patients coming through our facilities have not gotten sick, and it's because we mask.
Yeah.
That's number 1, 2, and 3. So that's all you really have to do. The vaccine is coming. I know it's very stressful when you think it's so close, but you don't need to call your medical practice because no medical practices have received vaccine. A few urgent care centers, not the Caremount urgent centers in the area, got vaccine. It was supposed to be for their staff, but they ordered too much, and the state said, all right, since you ordered it, you can give some out. So you may see some in local urgent cares. Other than the hospitals tend to have it first, but other than that, it's going to be a little while. But at least for Caremount, we're going to reach out.
And you're going to reach out, and I know that Caremount has, like I said, a great presence here in Yorktown, and I hope that we can count on that presence to continue. And I know that you're working diligently to bring the vaccine here to our residents. So I really do appreciate it.
Thank you for reminding me. We will have, I'm not going to say where, we will have a vaccine clinic in Yorktown, but it's going to be by appointment. Right. Now, when things get better, honestly, I think in May, we're going to have all the vaccine we want for everybody. And when that happens, we will just open the doors, and just like a flu clinic, it'll be a walk-in clinic.
Great.
But we're a little bit a ways, but it's going to be this year.
The $1 million question that's out there is: is the summer going to be the summer? Any thoughts on that?
Personal prediction?
Personal prediction.
If you don't hold me to it, because I've lied before, but I think we're going to have a real summer. I think we're going to get our lives back for the summer.
Excellent.
I think we will have enough people vaccinated or with natural immunity that we're going to have a summer.
And that's something that's a motivating factor right now for everyone watching and everyone who's going to be continuing to watch this over the weekend. Again, if you want that summer, if you want, to have our kids playing Little League Baseball, if you want to, all those good things that we've come to miss, but also realize how much we love and enjoy, you have to make those smart decisions. You have to make those responsible decisions now to help us get to that point. And Dr. Cole has provided such great insight for us on the vaccine, on where we stand today. I know that it's frustrating. I get the phone calls. I try to answer everyone's email who's reached out to us and return phone calls to our residents who have questions. But Dr. Cole is right on the front line with this. And so having him here with us today to provide this information is so important for everyone in Yorktown. So I hope that, again, you take the time to listen to his advice, understand where we are and how we're working towards a greater solution. And it's just so great to have partners like Caramount right here in the town of Yorktown who care for our residents, who are going to continue to work for our residents and continue to partner with the town. And it's just it's great to have you, Dr. Cole. As always, I do really appreciate your continued insight. And I've called you with questions when things started, when the vaccine started. You and I had a great conversation, and you told me everything that you had to give us the guidelines of what to expect and how you expected it to roll out, and the continued conversation and the continued communication has been great. So thank you.
Thank you for having me. You guys, Yorktown, you're one of the most responsible governments that we work with, and trust me, I've spent a lot of quality time with government folks this year, and you're always a pleasure to deal with. So for everybody, please take the vaccine. That's how we're going to get our summer back. And our world.
Heard it right here from one of our local experts. So let's take the vaccine. Let's make smart decisions. Let's make responsible decisions. Let's look forward to that great summer coming around the corner. And we're going to continue to provide our residents with as much information as we can. Continue to use that the community impact dashboard that our staff works every day. We're working on that dashboard. And just know that we're going to continue to share information. It's not that we're hiding information or we're not sharing it. We're providing every piece of information that we have. And again, it's working with our community partners like Dr. Cole and Caramount. So everyone back at home, enjoy your weekend, but be smart, be responsible this weekend. Okay? Make those smart decisions. Listen to what Dr. Cole said about if you think that it's a good idea to have people come to your house, wear the mask. Even if, again, especially for our seniors, if your grandchildren are coming over or your nieces or your nephews are coming over, you just can't take the risk. We're too close to that end zone to make a mistake. So keep up the great work. Keep making those responsible decisions, and we'll provide you with all the information that we can once we know it's accurate, and once we verify it, we'll bring it right to you, the people of Yorktown. So stay safe, stay healthy. We'll talk to you soon. Dr. Cole, thank you so much for all your help. Really do appreciate it.
My pleasure. Be well, everybody.
Thank you very much.